What's particularly clear is that the effect of aspirin on prevention is a long-term effect, and that not very much happens in the first 5 years after you take aspirin. That the preventative effects are really quite long-term. So that's very important in terms of how it should be used if you're going to need to start 5 years before there's going to be any benefit. That not very much happened in the first 5 years of treatment, but after that, preventative effects emerged for a number of cancers. The most striking were for, again, colorectal cancer, esophageal cancer, and to some extent stomach cancer. So it looks like all of the gastrointestinal cancers might be quite substantially impacted, with maybe a 1/3 reduction, as much as that, with long-term aspirin use. But there also was emerging evidence for a few other cancers, notably breast cancer, ovarian cancer, lung cancer, and prostate cancer. There the evidence is less clear and less striking, but overall, the deaths from cancer overall in these studies were reduced by 20%. So there is something going on above and beyond just what was seen in the colon cancer. The data from the Rothwell paper did suggest that the low dose is maybe as effective as the higher dose, but we probably need more evidence on that to be quite certain about that. The other major issue is at what age to start and stop taking aspirin. And that's very much a balance between the benefits in terms of cancer and heart disease, and also the risks in terms of gastrointestinal bleeding. There's emerging evidence that the bleeding effects are particularly serious in individuals over the age of 70, and typically in younger people they aren't so serious, and they tend to disappear after stopping treatment without any serious problems. So that needs to be looked at more, but it does suggest that one should maybe be thinking about starting around 50 to 55, and maybe taking it for 5 to 10 years, and then trying to finish before you get to 65 or 70, where the side effects are more potentially striking. That's very much an area for research now. We don't really have clear answers, but those are suggestions.